Hello, my name is Professor Michael Kidd. I'm Deputy Chief Medical Officer with the Australian Government Department of Health. And joining me today is Linda, who is my Auslan interpreter. I'd like to say a huge thanks to everybody in Australia working in aged care, whether you're working in a residential aged care facility or providing home care and support to senior people in Australia. The work that you do is incredibly important and hugely valued by the senior people who receive your care and by their family members. And as the son of a mother who is receiving aged care services, I am so grateful to the people who provide that care and support to my much-loved mum, as I know people are right around the country. So thank you for all that you are doing to protect the older people who are in your care. And thank you to everybody who has been vaccinated against COVID-19 or is planning to get vaccinated over the next few days. It's absolutely essential that we protect these very vulnerable people, the oldest people in Australia, against COVID-19. We know that elderly people are at much increased risk of serious disease and death if they're infected with COVID-19. So thank you for all that you are doing. So I have three questions that you've asked, which I'm going to answer today. So the first question is the COVID-19 vaccine safe if someone is pregnant? And the answer is yes. The vaccine which we're offering in Australia to women who are pregnant or planning pregnancy or breastfeeding is the Pfizer vaccine. And we have actually prioritised pregnant women to receive the Pfizer vaccine. This is because of the advice from the Australian and New Zealand College of Obstetricians and Gynecologists, and also from the Australian Technical Advisory Group on Immunisation, the group we call ATAGI, which has looked at the evidence from around the world, evidence which shows very clearly that the Pfizer vaccine is safe for women who are pregnant, but also evidence which shows that pregnant women are at increased risk of serious illness if they become infected with COVID-19. And also the unborn baby of pregnant women is at increased risk if the mother is infected with COVID-19. There's a risk of premature labour and the complications which arise from babies being born too early if the mother is infected with COVID-19. So it's very important that we are protecting pregnant women right across Australia. And we're doing that through the Pfizer vaccine. So if you're pregnant, or if you're planning a pregnancy, or if you're receiving in vitro fertilisation, IVF treatments, or if you're breastfeeding, please know that you can safely receive the COVID-19 Pfizer vaccine. It will protect you, it will protect your unborn child, it will protect other members of your family, and it will protect the senior people who you are providing care to each day through your work in aged care. The second question is, can you get a COVID-19 vaccine in Australia if you don't have a Medicare card? And the answer again is yes. COVID-19 vaccines are available free of charge to every person in Australia, whether you are an Australian citizen or a permanent resident, whether you are here on a visa or an international student or an overseas worker or someone who is seeking refuge or asylum in Australia. Every single person in Australia is eligible for a COVID-19 vaccine. If you do not have a Medicare card, you can get the vaccine through one of the state or territory hubs or through one of the Commonwealth vaccination centres, which we've set up right across Australia in rural areas and also in urban areas right across this country. It's very important that everybody in Australia receives the COVID-19 vaccine. The vaccine doesn't only protect you from serious illness or the risk of death from COVID-19, it also reduces the risk of you becoming infected with COVID-19, and if you are infected, it reduces the risk of you being able to transmit COVID-19 to other people. So having as many people in this country vaccinated as possible is a really important part of our national COVID-19 vaccine strategy. Our third question is, I'm working in residential aged care, but I don't want to be vaccinated. What can I do? Well, from the 17th of September, everybody working in residential aged care facilities right across Australia is going to need to have either had at least a first dose of a COVID-19 vaccine or to have evidence that they have an exemption to vaccination. Each of the states and territories has issued or is issuing public health orders which describe who needs to be vaccinated and what exemptions, if any, are available. So please look at the public health orders for your state and territory. If you don't have one of the exemptions which are accepted in your state and territory, then in order to continue working in residential aged care, you will need to have had at least a first dose of one of the COVID-19 vaccines. We are prioritising the Pfizer vaccine for everybody working in residential aged care, no matter what age. So that includes people who are aged over 60 years of age. You can also receive the Pfizer vaccine if you're working in residential aged care. The public health orders cover people who are working full-time, part-time, casual, students who are attending facilities, and also people who are volunteers who are being engaged by residential aged care facilities. If you need further details about the mandatory vaccination requirements for residential aged care workers, please go to the Australian Government website, health.gov.au. Put details about residential aged care workers in the search function and you'll find the details that you need. A reminder, if you need to talk to someone about COVID-19 or about the vaccine program, you can call our hotline on 1800 020 080. And if you need access to an interpreter service, or if one of your colleagues needs access to someone to explain details of COVID-19 or the vaccine program in another language, please call the interpreter service on 131450. That's 131450. We're very keen to do all that we can to assist you to get vaccinated, to protect you, to protect your clients, to protect your family and the wider community from COVID-19. So if you are having trouble getting a vaccine, please talk to your employer. They will know about whether there are special teams coming to visit your residential aged care facility to vaccinate the workers on site, or they'll know where you can get access to the vaccine from one of the many thousands of hubs and general practices and other sites around Australia. Please get vaccinated. In doing so, we're protecting the vulnerable senior people in our country. And that's our answers to your top 3 questions. Thank you for joining us today, and a big thank you to Linda.